Perhaps we'll take the questions and then you can, all three of you, respond to what was raised. Any questions from the audience? שאלות מהקהל, הערות?
זה כל כך נורא.
I have one question. You were talking a lot about prevention, and as we know that many of our prevention efforts at the time are insufficient, what about interventions to reduce the consequences of neglect during adolescence or young adulthood?
Going into intervention, not just prevention.
Where's the mic?
The mic.
Ah.
Okay, so
Do you want to go first?
You want to say something also? No?
You want to go? So it's actually a good question that you raised, particularly when you added about adolescents and young adults. Did you ask that?
Yeah.
Because in general, much more of the focus has been on young kids. And young kids are very, very important. But it doesn't stop, obviously, at age 3 or age 5. And we have not always done a very good job attending to the needs and problems of teenagers and perhaps young adults who have been neglected or abused, for that matter. So when you talk of interventions, I think, and again, coming back to Rami's point, there is, and I try to briefly illustrate, enormous heterogeneity in how neglect manifests. And so it's absolutely true that we need heterogeneity of responses. So in terms of interventions, just to give a few examples from the US, one we started with our School of Social Work called Family Connections. And this is a home visiting program that works with families, often involved with the child welfare system. Interestingly, we started it with kids who were a little bit older because we thought there's so much talk about 0 to 3. Let's do something for the kids who are 6, 7, 8 years old as well. And so there are several papers and replications of this model mostly using social work students who have to be very well supervised as the interventionists to work with high-risk families in their home, and there our focus has been on neglect. I think of the broader level of what are the needs of these kids when we are trying, for example, to get mental health services. And none of these by themselves is a panacea or silver bullet by itself, right? We need many strategies. We need a menu because the needs can vary. But this is another example to think of a teenager or younger kid who might need mental health support. And this is another big fight because I think, as I mentioned earlier, making sure that such services are available for kids who perhaps have been neglected. So that's an example where it can't just be in one part of Tel Aviv or one terrific program in one hospital, but of course it's throughout the country where kids are scattered and may have such a need. So it really screams out for a broader societal response to how systematically ensure that kids everywhere who have that need can have that service. Just some thoughts.
Yeah.
I would like to add, sorry for my English, I come from Spain. I would like to add some thoughts about the different types of neglect. And I fully agree that Howard would agree that there is many neglects. But I think that it's difficult to find cases when a neglected child don't receive food or clothes, and when they receive receive emotional support. In the opposite side, you can find cases of emotional neglect, don't receive emotional support, and they are receiving good food, good clothes, etc. But I think it's difficult to find in the opposite side. Why? Because I think that we need to rethink the way that we classify, sorry for the word, neglectful families, and put the target in the family. And I try to go away from the societal neglect, and I go to neglectful parents. Some neglectful parents have mental retardation, for instance, and this is a totally different issue than alcoholics or drug abusers. Totally different than many depressed mothers or fathers. And then other kinds of parents who can take care because they don't feel, I'm sorry for the word, something like empathy, like suffering, when the child is suffering. And when the societal neglectful, I'm sure that when a mother or a father can't give food to a child, she is suffering. A neglectful mother or a neglectful father who is looking at the child suffering, it's difficult to explain what this is happening. And I thank you for, I don't know if you know me, but I'm Nicole. My name is Joaquin Dipol, and you wrote that Nicole and Kiperel. Oh. And I wrote this paper trying to add some knowledge about lack of empathy and difficulties in bonding as an explanation of some small or big group of neglectful families, not the full picture. I think we can't understand neglect if we talk about neglect as a unique. I try to say mental retardation or alcoholic or depressive families or lack of empathy. But I'm very concerned about this kind of families that we talk immature parents. This is a nice word. Yes, we say immature. It's when there are young mothers and fathers who are unable to prioritize, to give priorities to the child needs in front of their needs. And I think it's a key question that must be prevented, because treatment is very important in this situation. As soon as the child is getting older. But it's only a comment about this.
Thank you very much.
Thank you.
It's a paper, actually.
So, first of all, thank you for introducing yourself. I think it amazes me each time when I see a great researcher and then I can combine his name with, so thank you for that. And I want to comment two things about what you said. The first one is I have to say that from my experience as social workers and for things that I saw or hear, I do think the other way around, because I do see many times parents who don't have any food to give to their children, but there's plenty of love there. And I remember one specific time that I sat in front of a mother, and I said, oh my God, I wish you would take me and give me parent training, how much love and empathy and compassion she has towards her children. So I can definitely see the other way around. And my second comment is about the emotional attunement that you talk about. And I think it's an amazing challenge for us as practitioners and researchers, how to overcome this emotional attunement, how to help parents and families to create those intimate relationships within the family. So you're right about this comment. So thank you.
I'm wondering about data about resilience factors. What make these kids that live in poverty conditions and are still more resilient from the other kids that remain in some
The
condition.
$1 million question. I think this will be for the next conference because we are out of time, so only if you have a quick response. But this is really very interesting to see. Two children with the same
We give a
condition,
quick
one
response.
become a social worker, the other
He knows
one.
the answer. He has a very quick answer.
Just a very quick response to that. So there was a fascinating study done on the island of Kauai. And if you ever have a chance, it's a great place to visit. Kauai, the smallest garden isle. And they studied all the kids that were born on the island, I think in like 1958. And then looked at how they turned out about 30 or so years later. And there was one strong predictor of good outcomes. And some had gone through adversity. And the strongest predictor was that there'd be at least one adult, usually one parent, who thinks you are fabulous, who's got your back, who really loves you. It's better if they're 2 or 3 or 4, but at least one was a powerful predictor of good outcomes. So
Let's work on it.
that's at least a minimum.
My dearest grandma was that person for me.
You are wonderful.
Thank you very much.